Thank you. I declare open this hearing of the Public Accounts and Estimates Committee. I ask that mobile telephones please be turned to silent. On behalf of the Parliament, the committee is conducting this inquiry into vaping and tobacco controls. I advise that all evidence taken by the committee is protected by parliamentary privilege. However, comments repeated outside of this hearing may not be protected by this privilege. Witnesses will be provided with a proof version of the transcript to check, and verified transcripts, presentations and handouts will be placed on the committee's website. I welcome you, Dr. James Martin, Senior Lecturer in Criminology from Deakin University. I'm going to invite you to make an opening statement or presentation of no more than 5 minutes, and this will be followed by questions from the committee. I'm going to hand over to you, Dr. Martin.
Hey, good afternoon, and my thanks to the committee for the opportunity to speak with you today. Australia's tobacco control policies are in disarray. For over a decade, we've seen the introduction of increasingly restrictive and coercive measures that have escalated to such a degree that for many, they now constitute prohibition in all but name. For cigarettes, this has predominantly been through the imposition of an endless series of extraordinary tax hikes in an attempt to force smokers to quit. As a result, Australian cigarette prices are now the highest in the world, meaning that for many smokers, people who are disproportionately concentrated in disadvantaged groups, legal tobacco is simply no longer affordable. For vapes, we've seen a prescription scheme that has been rejected by 96% of people who vape, which will be replaced in October by a pharmacy model that has been rejected by most pharmacies. We still have bans in place on the devices and flavours that the vast majority of adult consumers use, bans that research shows, when they have been implemented in other jurisdictions, have led people back to smoking, the #1 cause of preventable death. These policies have been advocated by an unchecked echo chamber of overzealous public health organisations that are not only out of step with international research, but also with realities on the ground. With the ban on consumer vapes affecting nearly 1.5 million Australians, we have created the second largest illegal drug market in the country and a massive new front in the war on drugs. Together with the steadily increasing black market for cigarettes, this has been an extraordinary multi-billion-dollar gift for organised crime. Battle for control of the black market has resulted in unprecedented violence on our streets, a staggering 87 firebombings, multiple homicides, and the extortion and intimidation of law-abiding citizens who have been unwillingly co-opted into criminal activity. This is a major crime problem of the government's own making, one that the police and border force have acknowledged that they do not have the power to stop. Public health experts will tell you that the solution is yet more law enforcement, more bans, and the closing of regulatory loopholes. This reflects a fundamentally flawed and frankly utopian view of how black markets operate. It also shows that they are now dictating policy in areas in which they have no understanding or expertise. With sufficient supply and demand, both of which are more than evident with vapes and tobacco, illicit supply chains adapt around whatever obstacles are put in their way. Stiffer sentences, tougher laws and fines are not effective deterrents for organised crime. They are job opportunities. And the bigger the ban, the tougher the border, the more they can charge for their services. We know this because we have over 50 years of research into the war on drugs. This has conclusively shown that prohibition, whether it's called that or not, does not work. Despite the ever-increasing billions we spend on tougher enforcement and the record numbers of arrests and seizures, we have lower illicit drug prices, increased availability, and record consumption. Contrast this with our approach to alcohol. To help minimise the harms associated with this addictive, cancer-causing, and incredibly popular and harmful drug, we have strict licensing laws, limits on hours of sale, and a restriction on supply to under 18s. This harm reduction approach has seen drinking rates for adults steadily declining and underage drinking rates slashed by 50% over the last 2 decades. This remarkable success has occurred without imposing unrealistic bans on adult consumers who remain free to purchase alcohol in whatever strength or flavour they choose. The reason that our alcohol laws are succeeding while our drug and tobacco laws are failing is that people naturally resist being forced, whether by governments or by Puritans in public health, into what personal health choices they should make. In the same way that the members of the committee would likely resist if similar choices were being made on their behalf as to what they should eat for breakfast or whether they are permitted a second glass of wine after dinner. The reality is that unrealistic public health policies have transformed 2 legal, peaceful markets into increasingly uncontrolled and violent ones. In imposing bans and restrictions, and now issuing public fines on Australians whose only crime is using a less harmful alternative to cigarettes, they have betrayed a moralistic fixation on nicotine consumption and taken their focus off the biggest killer in the country. We need to stop criminalising these markets. We need to stop stigmatising, pathologising and punishing people who vape. Further positive change in reducing smoking-related harms is possible, but not through force and coercion. It will only be achieved through genuine and supportive engagement that respects the choices, dignity and autonomy of our fellow Victorians. Thank you.
Thank you, Dr Martin. We'll go straight to Mrs MacArthur.
Thank you, Chair. Thank you, Dr Martin, for appearing today. Now, these bans that have been put in place have been justified on the basis of a so-called teen vaping epidemic. Can you tell us about this?
Yeah, this has been one of the most frustrating things from a criminology perspective, to see the really poor communication done in the media and by some in government and academia as well. The government's own data shows that there is no teen vaping epidemic. Over 70% of teens have never tried a vape. The majority of teens who do vape do so infrequently, consistent with casual experimentation. Just 3.5% of teens vape daily. Now, that's not great. We don't want any teens vaping or drinking or using illicit drugs, but we need to keep this in proportion. It's fewer than the proportion of teens who were smoking daily a decade ago. So we know that vaping, by contrast, is overwhelmingly an adult phenomenon. 93% of people who vape in this country are over the age of 18. So we shouldn't be using this tiny proportion of problematic teen use as a basis on which to determine our entire tobacco control policy.
Oh, thanks, Dr Martin. But hang on a minute. Aren't teens 3 times more likely to smoke because of vaping?
Yeah, again, this is another misleading and often misinterpreted claim. Yes, we do know that teens that try vaping are also more likely to try smoking, but this is a correlation, it's not causation, as it's often falsely interpreted. So when we look at the age cohorts, so teens and younger adults and we see higher rates of vaping, we actually see declining, the fastest declines in smoking. If there was a gateway effect into smoking from vaping, we would see the opposite. We would see increased rates of smoking. This trend is particularly evident amongst teens, amongst whom smoking has dropped to record low levels and has nearly been eliminated.
Okay, so our tobacco control sector regularly describes itself as world leading. Is this the case, or are there other countries with different policies that work better?
Yeah, Australia's self-described world leading is not the case. That is not an accurate description, and it hasn't been for some time. We can look at multiple jurisdictions around the world that do better in tobacco control than we do. If we go across the ditch to New Zealand, for example, they've seen a remarkable reduction in smoking rates since they legalised and regulated vapes back in 2020. So their daily smoking rate is now below ours. Probably the biggest success story here has actually been Sweden, though. So they've not only legalised vaping, but a range of other less harmful nicotine products. They've got a daily smoking rate of 5.6%. So they're likely to be the first country in the world to reach the 5% threshold for what is considered smoke-free. So these are the other countries that are doing it better. And they're not doing it better by using these coercive measures. So cigarette prices in Sweden, for example, are about half the price of what they are here. So by providing these other less harmful alternatives, diverting smokers away from tobacco, we're seeing these remarkable successes.
Mm-hmm. So are there any other ways that you could recommend to the committee that we overcome this problem?
Yeah, absolutely. I mean, I think we need to embrace the principle of harm reduction. So there are a range of less harmful tobacco or nicotine-related products. Vaping is the #1 most popular of these, but nicotine pouches, for example, have been shown in Sweden and elsewhere to successfully divert people away from smoking. And I think we need to be mindful, nicotine is not the problem. The vast majority of the negative health effects that come from smoking are from the secondhand smoke. That's got all the tar, the thousands and thousands of carcinogenic chemicals. If you can get the nicotine without that, then you can start to see really serious reductions in tobacco-related harms. And we've seen this in Sweden. There's been a massive reduction in the number of cancer cases, smoking-related morbidity and mortality. So we do know what works, and it's not, unfortunately, what we're doing here.
Could you direct us to this research that you know about that's occurred in Sweden that gives us these fine results?
Yeah, absolutely. There have been multiple studies, and I'm happy to email them to the
Great. The committee would be most grateful. Are there other countries apart from Sweden that you'd like to point to that are doing this job better?
Yeah, I mean, I think New Zealand is. We've seen massive smoking reduction rates in the United Kingdom. The UK National Health Service, for example, gives free vapes to smokers at taxpayer expense to get them off smoking. So, you know, these are countries that have embraced rather than suppressed these less harmful alternatives. And they're the ones that are really making the really successful strides in recent years.
Now, we understand also, Dr. Martin, that there's a major environmental problem that occurs from vapes. Are you familiar with that?
Yes, I am. So there are environmental problems associated with vapes, particularly with disposable vapes. These are dwarfed in comparison to the environmental problems that are associated with cigarettes. So we know cigarette butt litter is really serious. But again, there are ways around this. Countries that have legalised vaping, you can have recycling schemes set up that, you know, collect disposable vapes or even non-disposable vapes for recycling purposes. So a lot of the environmental problems that we see with vapes are associated with the fact that they're illegal, they've been criminalised, and the government doesn't provide those kinds of recycling options available.
So there are major other products in illegal vapes that must cause massive health issues. Are you familiar with those?
Yeah. So this is what we call the iron law of prohibition, and that is when we ban a substance, we start to see the criminal substitutes that come through having more serious health effects than the legal ones that are available. So the illicit vapes that are coming through now have much higher levels of nicotine than anything that is available in a legal regulated product. So the same sorts of things that we see with illicit drugs, we're seeing with vapes now as well.
Should pharmacists be tobacconists?
No, I don't think they should. And in fact, I don't think we should be treating these products as medicinal products. These are consumer adult products, and they should be regulated in much the same way as we regulate cigarettes and we regulate alcohol.
Okay, thank you.
Thank you, Mrs MacArthur. Mr Galea.
Thank you, Chair. Thank you for joining us today, Dr. Martin. In your earlier remarks, you said that 70% of teens have never tried a vape, and I think you said just 3.5% vape. What's the data that shows that? Can I ask what's the particular scientific papers? Are they Australian or foreign?
Sure, yeah. This is from the government's own National Drug Strategy Household Survey. Mm-hmm. This is published every 3 years by the Australian Institute of Health and Welfare. It's widely considered the gold standard in public health research, and it's relied on for our knowledge of illicit drugs and elsewhere. I'm happy to email the relevant data to you.
Terrific, thank you. You also mentioned that vaping leading to smoking, you said that correlation wasn't proven by causation. Mm-hmm. Do you contend that it's been proven that there's no causation or that there's no evidence either way?
Well, there's strong evidence against. And that's not to say that some teens who vape or some people who vape don't go on to smoke. There would be some people who would follow that pathway. But we need to consider this not at the individual level, but at the population level. So as I mentioned before, and this is from the National Drug Strategy Household Survey as well, that the fastest reductions that we've seen in smoking in recent years have been amongst age cohorts that have shown the highest uptake of vaping. Mm-hmm. So if we were going to see a gateway effect towards smoking, we would see the opposite. We would see more people in those age groups that vape the most smoking, but in fact we see the opposite. So this suggests that vaping is not a gateway to smoking, but rather is displacing smoking, which should be welcome from a public health perspective.
Yeah, thank you. Do you have any data through that as to the amount of vapes that have nicotine in them or not?
Well, I think it's a bit of a furphy to think that there's many nicotines that are any longer being sold in Australia that don't contain nicotine. So this was certainly the case when we had a legal vaping industry. That vaping industry has been shut down now, mm-hmm. and it's been replaced by a black market industry. So if you go in, purchase any of those black market vapes, even if they say they don't contain nicotine, they almost inevitably will. I would be surprised if any of them didn't contain nicotine.
Often at extremely high levels.
Exactly,
yeah.
And much higher levels than would otherwise be available.
Thank you. In your submission, you've spoken about the announced reforms in Victoria of bringing in tobacco retail licensing, and you've spoken in favour of that. Can I ask from your perspective what specific measures this policy should include to ensure it's successful?
Yeah, so Victoria is unusual amongst Australian states in not having a licensing regime for the sale of tobacco products. In fact, you don't even need to be over the age of 18 to sell tobacco products in Victoria. So, you know, my argument is that we should treat both vaping and tobacco products in the same way as we should for the sale of alcohol. So there needs to be strict licensing regime there, make it easy for inspectors, have serious penalties associated with non-compliance, such that we promote responsible behaviour amongst people who sell nicotine products in the same way as they do alcohol products.
Thank you. And would you support it being overseen by the same authority that manages liquor control?
No, I don't think you can. Certainly at the moment, while the trade is being completely dominated by black market actors, it's not feasible to have health inspectors and people, frankly, who are outside law enforcement policing these premises. If they're run and owned by organised crime groups, serious threats, credible threats, violence and intimidation are going to be in place. So you need to have proper backup from law enforcement agencies to regulate a black market. That being said, once you have a legal market, this policy is unsustainable in my view. If it was to be replaced by a legal, regulated market, that is a different story. You could have health inspectors without police support going in and regulating those places in the same way that you do with alcohol.
But if I can paraphrase, what you're saying is, given the situation that we are currently in, it would need a firmer response from the outset. Is that?
Yes, absolutely. Yeah, you would need law enforcement involvement.
Thank you. You mentioned the Swedish model there. Can you talk a bit more detail about what exact measures they brought in which had that impact?
Yeah, so Sweden has a legal regulated model for nicotine-containing products. You might have heard of snus before. That's a popular sort of mouth patch that contains tobacco as well as nicotine, obviously. That has been replaced in recent years by nicotine pouches, which are synthetic, do not contain tobacco, but do contain nicotine. Tobacco pouches, nicotine pouches rather, have the same risk profile as legally available nicotine gums and sprays. They're not associated with cancer. They don't have significant health risks associated with them. And they're far less dangerous than alcohol, for example. You can buy nicotine gum and sprays from your local Coles. I'm not suggesting that you should be able to buy nicotine pouches there. I think any nicotine-containing product should be sold from a licensed retailer with strict age verification and so on. But they're the kind of approaches that they have in Sweden that have dramatically reduced their smoking rates to almost that smoke-free threshold.
Thank you. And in terms of smoke alternatives, so vapes and other things, pouches which you've mentioned, do you think that the tobacco companies have a role to play in these fields, or do you perhaps not trust their ulterior motives?
Yeah, I have no love for tobacco companies. I think it's noteworthy that the only vapes that you can access in Australia, or that are widely prevalent at least through the prescription scheme, are provided by Big Tobacco. So let's not pretend that the current regulatory model is a huge enemy to Big Tobacco. Vapes and nicotine pouches represent a threat to their business model. But from my perspective, the focus needs to be on tobacco consumption. It needs to be on smoking, because that's where all the harms, or the vast majority of the harms, lie. If tobacco companies pivot to less harmful, more nicotine-containing products, whether that's pouches, whether that's vapes, I would consider that a positive outcome.
Thank you.
Thank you, Mr. Galea. Mr. Puglielli.
Thank you, Chair. Hi. In the legal and regulated market that you would see as a proposal for this country, do you have any particular arrangements you'd like to see regulated in terms of flavouring and packaging? Like, what would be best practice for you?
Yeah, so again, this is a bit of a furphy we see in the media, that because vapes contain flavours, that this somehow means they're marketed towards teens. We know that flavours are really important for adult vapers. And there are studies, again, that I can send to the committee that have shown that they're really important in incentivising adult smokers to quit. Vapers don't, if we look at the flavours that are available through the government's pharmacy, or prescription now pharmacy model, we've got mint, menthol and tobacco. These are amongst the least popular flavours amongst adult vapers. And flavours are actually more important for adult vapers than they are for teens. So the government's National Drug Strategy Household Survey shows that the main reason that teens try vaping, 3/4 of teens who try vaping, is because they're curious. And around 15% say that it's because they taste better than cigarettes. Those numbers increase if we start looking at the adult proportions. So flavours are more important for adults who vape than they are for the minority of teens who vape.
Okay, and so I suppose just from the previous sessions we've just had, which I think you said you hadn't managed to catch, the characterisation of the current flavours on offer as adult flavours, would you disagree with that characterisation based on what you've just said?
Yeah, I would. I mean, members of the committee presumably eat fruit. I'm partial to the odd tiramisu myself. Fruit flavours, dessert flavours are not limited to children. Adults enjoy these products in foods and desserts, and they're going to prefer these flavours in vapes as well, and that's what the research shows.
Earlier in your remarks, you spoke about the need to stop punishing people who vape. Could you go into a bit more detail potentially around any concerns you may have of personal prosecution for possession, things like that you perhaps noticed in other jurisdictions? Yeah,
absolutely. And I think the Greens have been really important here in getting rid of the prescription model that would have seen, and adjusting some of the legislation around what threshold quantities. We know that vapers, when they're being confronted with these laws, have started stockpiling devices and fluids, which in many instances I think would lead people who are not involved in commercial supply, but breaching the kind of thresholds that even now are still in place. So I think there's a real danger that we see with criminalisation of people who vape, people who aren't necessarily involved with commercial supply.
Okay, and with regard to, you've raised obviously concerns about the prescription model. My understanding of the current federal legislation that's coming forward for those under 18, it is still a requirement to have a prescription from a GP to access one of these products. Do you have, sort of flowing on from that, concerns about any young people who are dependent on these products for their welfare, or what's going to happen to them in the new legislation that comes forward?
Specifically around teens who vape, I guess I do. I mean, this is a level of scrutiny that we don't see with teens who smoke. I can't remember the last time a teen who was caught smoking was subjected to any form of law enforcement activity. If they're engaging in a far less harmful alternative, and vaping is widely considered, at least overseas, international research and by public health organisations overseas, as considered less harmful, I don't think a criminal response or a fine would be warranted.
Okay, and to clarify your perspective on vapes as a product, so you said before that you wouldn't view it as a medicinal product. Would you say it's a diversion product, a cessation product? How would you differentiate some of these terms?
Well, I think what we see in the research now in the National Drug Strategy Household Survey is that it is displacing smoking. So I think we can consider it a substitute for cigarettes. And I think it should be treated not as a medicinal product. I think, again, this is one of the problems. These policies have been made not in consultation with people who vape. This has been a top-down approach. And I think if you spoke to the average vaper, they would not consider themselves a patient who is sick and is in need of medicine. I think they would consider themselves someone who is sensibly exercising a consumer choice for a less harmful nicotine-containing product. So I'd advocate for a regulatory model that treats them not as medicinal products, but as an adult regulated consumer product.
Okay. Thank you. Thank you, Chair.
Thank you, Mr. Puglielli. Mr. Tack.
Thank you, Chair, Dr. Martin. I want to go back to your law enforcement component. Mm-hmm. The Victorian Police and others have advised that the tobacco licensing alone is needed along with strong enforcement to make it work. Can you explain why a licensing scheme in isolation would not work?
Yeah, absolutely. Happy to. The main problem here, and we see this with the regulation of other illicit drugs, this is, if we consider this from an economic perspective, this is the most important thing to argue. When there's sufficient supply and demand, it doesn't matter essentially what the government interventions are, because criminal actors who specialise in evading government controls, whether that's at the border, whether that's on the street, will adapt. So we see this with other illicit drugs. These are not deterrents, as I said. They are job opportunities, because it's criminal organisations who specialise in evading these controls that they actually rely on these control measures to charge for their services. So, you could double the law enforcement budget, the drug enforcement budget, which is around $3.5 billion. spent nationally on drug law enforcement in Australia. That's triple what we spent 15 years ago, and despite that, we have increasing rates of illicit drug use, we have increased availability, and often lower prices for illicit drugs. So this is, I think, pretty conclusive and damning evidence, quite frankly, that relying on a law enforcement response when you've got these huge economic drivers of black markets is just simply not effective.
Thank you for your answer. Thank you, Chair.
Mr Hilakari.
Yep.
Thank you, and thank you for attending today. You stated earlier there's a natural resistance in reference to markets like this, or is it really actually related to people participating in drug addiction as opposed to a natural resistance to licensing regimes or prohibition regimes?
Mm-hmm. Well, I mean, addiction's a really slippery sort of concept. And differentiating between addiction and use that is problematic, use that people want to stop, is really difficult to do. And addiction specialists, have varying definitions of what addiction actually is. So I think, yeah, it's a tricky issue to consider. If we think about this in terms of other drugs, you will hear people who drink coffee, for example, saying, "I can't function in the morning before I get my cup of coffee." We don't consider that addiction, but it is addiction. And they will, if people who are addicted to caffeine do not get their morning cup of coffee, they'll get headaches, they'll get other.
Probably don't cost the health system so much, though, do they?
Well, it depends. I mean, if you.
But I might move on.
Yeah.
Certainly, in terms of a licensing scheme, would you support that it would reduce the tobacco-related criminal elements, even without a substantial enforcement process?
I think it could at a lower kind of tactical or investigative level, but I would again stress that without addressing the economics, the underlying black market economics that are promoting this, the demand and supply, it is really just window dressing. It's a band-aid on an otherwise, serious and untreated wound.
And just in in your experience and understanding of looking at places like New Zealand and Sweden, you mentioned a few times displacement. And, to me, that's a little bit of a replication of one for the other. But is that a reality, or in reality, are we seeing much more increased use of nicotine products when vaping pouches are available, or are we seeing a flatlining? Because the evidence that I've seen from New Zealand is that there's almost 4 times as much usage of nicotine products by young people. So it's not a displacement, it's actually an increased usage.
Yeah, but again, I think we need to differentiate.
And I accept the idea that you're putting forward that the harm is less per usage.
Much less, yes.
But there's a significantly higher level of usage. Is that what you're observing and what your knowledge is?
I'm not sure. I'd need to check that data.
Thank you.
Thank you, Mr Hilakari. Well, Dr Martin, our time together this afternoon has come to an end. Thank you very much for taking the time to appear before the committee this afternoon. The committee will follow up on any additional questions or questions taken on notice in writing, and responses are required within 5 working days of the committee's request. The committee is going to take a very short break before recommencing the hearing. I declare this hearing adjourned.